The United States is witnessing a significant shift in how vaccines and related policies are being managed, particularly concerning COVID-19 boosters. A national consensus on vaccines is unraveling, and states are taking matters into their own hands. On the West Coast, officials from California, Oregon, and Washington have taken proactive steps to ensure their residents have continued access to vaccines. They've announced the formation of a health alliance that will set public health policies independently of the federal government. This move comes in the wake of the federal government's recent decision to suspend authorization for COVID shots for healthy adults under 65. This is one of the most dangerous times that public health has faced in the last 50 years, says Dr. Michael Osterholm, a vaccine expert from the University of Minnesota. Osterholm leads a project aimed at helping states and professional societies develop science-based vaccine recommendations. The actions taken by these states reflect a growing trend of states charting their own paths for immunization policies, especially in light of Robert F. Kennedy Jr.'s influence on federal health agencies. Kennedy, a longtime critic of vaccines, has reshaped federal policy to align with his views, often at odds with scientific consensus. Massachusetts, for instance, has firmly stated its commitment to maintaining vaccine availability. No matter what happens with Kennedy and the federal government, we are going to make sure vaccines remain available in Massachusetts, declared Attorney General Maura Healey. The state is actively working to ensure that all pharmacies can offer the vaccine as quickly as possible. Massachusetts is also leading the charge in forming a regional public health collaborative with every New England state except New Hampshire, as well as Pennsylvania and New Jersey. This collaborative aims to coordinate public health efforts and maintain vaccine access. Many public health and medical experts are lamenting the loss of national vaccination leadership. Just 5 years ago, the U.S. spearheaded the development of highly effective vaccines that played a crucial role in controlling the COVID-19 pandemic. Even President Donald Trump praised the vaccines as somewhat of a miracle. However, pandemic-era vaccine mandates remain a contentious issue, making COVID booster shots an easy target today. Several experts argue that Kennedy is exploiting public distrust and resentment towards these mandates to dismantle long-standing vaccination policies that have been vital to children's health care. Are you going to believe in science and the whole process of research and discovery? Or are you going to believe in the alternative, which is magic, smoke, and mirrors? Osterholm poses a challenging question. Kennedy's controversial actions include firing all 17 members of the Advisory Committee for Immunization Practices, ACIP, an independent board that advises the CDC on vaccine policy. Some of his replacements share his anti-vaccine or vaccine-skeptical views. He has also announced that the government will no longer recommend COVID shots for children and pregnant women. Despite evidence showing that young children are vulnerable to serious illness from COVID-19 and that newborns can benefit from maternal antibodies, these decisions have sparked significant backlash. Last week, Kennedy dismissed the CDC director for refusing to comply with his directives, leading 3 high-level CDC officials to resign in protest. Over 1,000 current and former CDC staff members have called for Kennedy's resignation over his vaccination policies. The Federal Department of Health and Human Services has not responded to multiple requests for comment. However, an HHS spokesperson, Andrew Nixon, criticized the Western States Health Alliance, stating that Democrat-run states that pushed unscientific school lockdowns, toddler mask mandates, and draconian vaccine passports during the COVID era completely eroded the American people's trust in public health agencies. In August, the FDA approved COVID booster doses only for individuals 65 and older or those with specific medical conditions. This marks the first time since the introduction of boosters that they are not universally recommended. The newly reconstituted CDC advisory panel is expected to concur with the FDA's decision, further limiting access to boosters for most healthy Americans. While the decision to restrict booster access isn't necessarily unscientific, health experts argue that maintaining widespread access to COVID boosters is still important. Dr. Robbie Goldstein, Massachusetts Public Health Commissioner, emphasizes that making shots widely available can save lives, especially for those on the margins of high-risk groups. The FDA's restrictions also create barriers for those who need the boosters. CVS, for example, announced it would not stock the doses at its Massachusetts pharmacies, anticipating the CDC committee's recommendations. Attorney General Healey's order aims to counteract this decision, and this is the part most people miss. Jennifer Nuzzo, director of the Pandemic Center at Brown University, warns that the restrictions on COVID boosters are part of a broader assault on vaccinations in America. She believes Kennedy is leveraging existing public resentment to attack vaccines in general. Despite some skepticism about COVID vaccines, the public generally supports routine childhood vaccinations for diseases like polio, measles, and pertussis. Nuzzo asserts that while support for vaccines has slightly declined, it is far from the crisis of confidence that some claim. Healey's order, along with expected actions from the Board of Registration in Pharmacy, may address CVS's concerns. The order authorizes pharmacists to administer 4 different types of booster shots to anyone over 5 years old, ensuring liability coverage even without the CDC Advisory Committee's recommendation. The resulting patchwork of vaccine policies across the nation poses challenges, including increased risks for interstate travel and a loss of the coordination and expertise the CDC once provided. Do I think it's an ideal situation? Hardly, Osterholm admits. This is about making sure vaccines survive in today's governmental world. What do you think about the current state of vaccine policies in the U.S.? Do you agree with the state's efforts to maintain vaccine access? Or do you think the federal government should have more control? Share your thoughts in the comments below.